Hello everyone and welcome to our class. This is the second lesson in physical education for the first quarter, and our topic for today is about first aid. For our most essential learning competency, at the end of the lesson you'll be able to perform appropriate first aid for injuries and emergency situations in physical activity and sports setting. Example is cramp, sprain, and heat exhaustion. By the way, I would appreciate if you will subscribe to my channel where I post all the lessons in MAPE. And if you like this video, please leave a like and comment after the lecture has ended. So let's get started. First, let us define the meaning of first aid. First aid is the immediate and temporary care given to a person who has been injured or suddenly ill. So meron ditong sinasabi na terminology. First is intermediate, ibig sabihin agad-agad. And second is yung temporary care, which means hindi pasamantala lang siya or hindi siya pangmatagalan. So it includes self-help and home care if medical assistance is not available or delayed. So, pansamantala, kaya nga siya sinabing pansamantala kasi habang hindi pa dumarating yung talagang totoong medical assistance, ito yung ibinibigay natin. And it is a prompt care and attention that sometimes means the difference between life and death or between a full or partial recovery. So, sobrang importante ng first aid kasi maaari siyang mag-determine ng kung mabubuhay ba o mamamatay isang tao, kung lalala o maiibsan yung kalagayan ng isang tao. So, ganun kahalaga ang first aid. So, what are the rules of first aid? First, it is the bridge that fills the gap between victim and the physician. So, habang hindi pa dumadating yung physician, yung first aider ang nagbe-bridge nung kinakailangan niyang lunas nung pasyente. Yun. Second is that it ends when the service of the physician begins. So, once na nandyan na yung doktor para magbigay ng talagang totoong lunas, then natatapos na yung role ng first aider. And then, it is not intended to complete or take the place of a physician. So, hindi na din intention na palitan yung role ng isang doctor or physician. As for the objectives of first aid, first is to alleviate suffering or bawasan yung paghihirap ng isang tao. Number 2, prevent added or further injury or damage, or paghintuin na o patigilin na yung mas lalo pang paglala nung kanyang injury or nung damage na tinamo ng isang tao. And third is to prolong life, lalo na nga kung situation ng life or death. Diba? Sa mga iba't ibang sports activity, meron din common na yun na nagkakaroon ng mga iba't ibang klase ng injury. And ito pa pag-uusapan natin ngayon is yung mga common injuries that are encountered by officiating officials and athletes. First is sprain. So a sprain is a stretch or tear of ligament, the band of connective tissues that joins the end of one bone another. So sprains are caused by trauma such as fall or a blow to the body that knocks a joint out of position and, in the worst case, ruptures the supporting ligaments. So ito ay kadalasan na nagiging cause ng trauma. Halimbawa, bumagsak yung isang tao pagkatapos niyang kumilos, di ba? Bawa tumalon siya tapos bigla siyang na out of balance sa pagbagsak niya. So possible na magkaroon siya ng sprain. So once na nagkaroon ng konting ng overstretch or napunit yung ligament or band of connective tissues nung kanyang katawan, then dun siya nagkakaroon na ng sprain. Second is strain. So a strain is a twist, pull, or tear of a muscle or tendon, a cord of tissue connecting muscle to bone. So it is an acute non-contact injury that include pain, muscle spasm, and loss of strength. Strain naman is meron siya, acute siya, ibig sabihin paulit-ulit na nararanasan yung pain na iyon na experience nung isang particular na muscle. So yan, kadalasan na ang naparamdaman is merong pain and then muscle spasm, yung parang muscle spasm, and then parang nawawala ng strength yung muscles. That is what we call strain. And then Third is knee injuries. So knee injuries can range from mild to severe. So less severe would be tendinitis or patellofemoral compression syndrome, iliotibial band syndrome, and bursitis, to name a few. So may mga technical terms yan na ginagamit to address yung knee injury or yung less severe na knee injury. However, more severe injuries include bone bruises or damage to the cartilage or ligaments. So, major injuries are common to the anterior cruciate ligament or ACL. Ito naririnig natin to sa mga basketball players, diba? Kapag nagkakaroon sila ng injury, yung ACL, PCL, MCL, at saka yung LCL. Yan. So, yan yung iba't ibang mga klase ng knee injuries. And then we also have fractures. So a fracture is a stretch or a break in the bone that can occur from either a quick one-time injury to the bone or acute fracture. Sabihin, one time lang or nagkaroon ng isang bagsak na nabali yung buto niya o nagkaroon ng konting basag yung buto niya, or from repeated stress to the bone over time, or also known as stress fracture, or dahil sa paulit-ulit na stress yung buto na yon, yung hanggang sa to the point na na-break na siya. So that is what we call stress fracture. So the most common symptom of a stress fracture is pain at the site that worsen with weight-bearing activities. And then tenderness and swelling often accompany the pain, and this is very important for the coaches to recognize and to refer the athlete to trainers of the team physician. So kapag halimbawa na laging na-i-comment or laging na lang nairereklamo ng isang particular na player na meron siyang nararamdaman na masakit sa kanyang buto o sa bahagi ng isang katawan niya na paulit-ulit na niyang nararanasan, then kinakailangan na i-report ito ng coach agad sa team physician para ma-address yung concern na yun nung athlete. Kasi baka nga mamaya, meron na pala siyang nade-develop na stress fracture. So, syempre, kapag hindi siya agad na-address, then maaring lumala yung kanyang kalagayan. And lastly, we have dislocations. So, when the two bones that come together to form a joint become separated or naghiwalay, the joint is described as being dislocated. So, contact sports such as football, basketball, and lacrosse, as well as high-impact sports that can result in successive stretching or falling, cause the majority of dislocations. So, a dislocated joint is an emergency situation that requires medical treatment kasi syempre masakit yon dahil na-dislocate yung mga joint o yung dalawang buto mo na dislocate. So, masakit talaga siya. Kaya kinakailangan talaga siya ng emergency medical treatment. So, what first aid can you give dito sa mga binanggit natin na iba't ibang common injuries kapag sa mga iba't ibang sporting events? So, tandaan lang natin yung acronym na RICE or RICE. So, RICE stands for Rest, Ice, Compression, and Elevation. First is rest. So, rest the injured part, especially for the first 24 to 48 hours after the injury. And this is the most critical time of treatment. So, avoid any activity that causes pain or makes it worse. Use crutches if the leg, foot, or ankle is injured. Support an injured wrist, arm, or shoulder with a sling. Tape an injured toe or finger to its healthy neighbor. So, sobrang importante na magkakaroon ka ng pahinga, lalo na na-injured yung isang bahagi ng katawan mo. Kasi nga, maaaring lumala ang kalagayan yan kapag talagang iginalaw mo pa. So, kinakailangan iwasan mo na yung mga activities na makakapag-cause ng pain or makakapagpalala dun sa sitwasyon nung part ng na-injured sa'yo. So, kung kinakailangan lagyan mo ng support, kinakailangan mong itip, or kinakailangan lagyan ng crutches para masupport yung injured part, gawin natin yon kasi para nga mas lalong makapagpahinga yung injured part. So, ang sabi dito, first 24 to 48 hours, yung parang suggested na number of hours na kinakailangang magpahinga yung isang tao na na-injured for treatment. Second is ice. So this is an excellent anti-inflammatory and it reduces swelling and pain. So applies an ice pack or cold compress for 10 to 15 minutes as soon as possible after an injury. So for example, nagkaroon ka ng sprain, kamali ka na bagsak. So yan ang immediate na dapat nang gawin as soon as possible. You have to apply ice pack or cold compress for 10 to 15 minutes. So repeat each hour for the first 3 or 4 hours, then 4 times a day for the next 2 to 3 days. Third is C or compression because this reduces swelling. So use elastic bandages for at least 2 days. Check that the bandage is snug but not too tight. So take the bandage off at night. So sa compression is yun lang yan. Gagamitan mo ng bandage para mabawasan yung pamamaga ng injured part. So siniguradin natin na yung bandage daw is snug pero hindi siya sobrang higpit. Baka mamaya kasi hindi na pumasok yung dugo dun sa part na injured. So hindi naman siya sobra dapat higpit pero dapat din naman na matibay siya. Hindi din naman yung sobrang maluwag yung pagkakabandage mo dun sa injured part. So and also take note that you have to take the bandage off at night. And lastly is elevation. So, it drains fluids from injured tissues. What is the meaning of elevation? So, pag sinabi mo elevation, itataas mo ng konti. Ayan. So, i-elevate mo. Iaangat mo siya. So, elevate the injured area whenever you are sitting or lying down. Kapag nakaupo ka, nakahiga ka, so dapat medyo nakaangat siya. So, try to keep the injured area at or above the level of the heart. So, yun yung ibig sabihin ng elevation. So that is the end of my discussion and I hope that you learned something from this topic. Leave a like and comment on this video if you like this content and don't forget to subscribe and hit that bell button. I appreciate all the love from you guys, so stay safe and see you again next time.